Right, great. Hello, my name's Kelly, and I think my slides are going to come up. Not that they're super interesting, by the way. It's me that's interesting, not the slides. But the slides will come up in a moment. So yes, as Imogen said, I spoke at the conference 2 years ago. Now, I first came, I think it was 2018 was the first conference that I came to. And then I was asked by Imogen to speak 2 years ago, and then Susanna asked me again, this year, which is amazing. So thank you very much. I missed last year because back in deepest, darkest Northumberland, it was half term and family first. I was gallivanting around the Canaries with my sapling. But it's not our half term this time, so all is good. I feel like I need my slides up. Sorry, I don't know why, but I feel like I do. Anyhow, like I said, my name's Kelly and I am a chartered physiotherapist. Can you hear me okay? Oh, click, Kelly, click. Oh, there we go. Great. Great, thank you. Sorry. There you go. I don't know why I feel like you need to say this, but you do. So my name's Kelly. I'm a chartered physiotherapist and I have a private practice up in Northumberland. We tend to see patients when they have exhausted all measures in terms of being seen by the NHS, and they will come to us when they have pain or dysfunction, or sometimes both. Now, lots of people fit into that bracket. There could be people that have sporting injuries, there could be children that have sporting injuries, there could be people who have chronic conditions where they're just feeling like they really need a little bit of help from somebody somewhere. And some of those patients have lymphedema. And we also see patients where we can hopefully try and get a little preventative care in. So say, for example, we might see patients that have just had some surgery and we're trying to get some preventative measures in to make sure, hopefully, that they don't necessarily get lymphedema. So my talk today is on a proactive approach. So we're going to be focusing mainly on what you can do to help prevent lymphedema and reducing your risk. I'm also a multiple melanoma patient. I hate saying patient. I mean, I know it's a patient network, but I refer to patients at work. They're like, oh, patients, patients. Whereas I feel like I don't feel like a patient. Like I am a patient. So I've decided to call myself a bod. So you're all melanoma bods in my eyes. So we're going to have lots of practical tips, hopefully. I think I meant to read these, but I keep just wittering on instead. Familial, it's on both sides of my family, and I've had it many, 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 many times, and I've had lots of surgeries, so I kind of know how lots of people in this room are feeling about the whole melanoma thing. So what we're going to cover is, what even is lymphedema? So let's think about what it is, or we will think about what it is, and then who gets it and why. And then we'll have a little chat about how you can prevent it, which is probably going to be the biggest part of my talk, and then how you can treat it. And actually some of the can you prevent it and how you treat it are kind of blurred a little bit, which you'll understand once we get there. So what even is it? Oh, hang on, let's go back again. So lymphedema, which we've heard quite a bit from lots of our amazing speakers already. They've touched a little bit about the lymphatic system and what it is and what it does, and the clues in the name. So you've got lymph, and then you've got oedema. Oedema basically means swelling, which actually, if it's okay with everyone, but you totally don't have to put your hand up. Who has been affected by lymphedema in the room? Oh, right, great, quite a few. Well, not great, obviously not great, but it means that this is applicable, so that is great. If you can put your hands back up, and if you have appropriate care and you're happy with everything and you've got lots of preventative information, can you keep your hand up? Oh, get in. Right, so this is why I'm here. Sadly, I think also I need to tell you what I'm not, which I did in the talk last time as well. I'm a chartered physiotherapist. I'm not a lymphedema specialist. I'm not a lymphedema nurse. It just happens that we see a lot of lymphedema patients in clinic. And we see patients also that have had surgery. That means that they might get lymphedema as well. So we're quite well placed, or I am well placed to be able to give you this information. So ultimately, lymphedema is a breakdown in the system somewhere along the line. So we have lymph fluid that kind of floats. This is not an anatomy lesson, I promise you, on physiology, but I think it's a really good idea to understand just a little bit more about what the lymphatic system does and what it is, to then understand all the preventative measures that we can do and why they're so important. So, sorry, I just lost my train of thought there. The lymphatic system basically collects a lymph that floats all the way through the body into capillaries, and then it goes through vessels, and then it travels in these canny little stations called lymph nodes, which are like filtration stations. So they are going to take out a lot of pathogens, take out a lot of bacteria, and then, as we know, they've got T cells in there, immune cells, so they put all the good stuff back in the lymph, and then on it goes on its merry way. The lymph system is a little bit slow, so I'm going to give you an analogy here, and please bear with me. So if we've got the circulatory system and we've got the lymphatic system, so imagine, does anybody race motorbikes in here? Oh yeah, great. Right, so we're on a track, yeah, a race track. And we have got a little Miss Circulatory System, and she rocks up and she's got the best leathers, she's got all her gels on board, she's had a really good breakfast that morning, she's feeling pretty good, everything's like super duper race, and then she gets on a Ducati and she whizzes round that system like nobody's business. So she goes round the track and there she is. Now the Ducati is the heart, pump, 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 and away she goes. And then you've got little Miss Lymphatic System, and she turns up in her, no disrespect, but Primark tracksuit. She's got a couple of leathers on that she's got from Vinted for cheapest ships. She's probably wearing Crocs. She hasn't got a very good bin lid on, and she hops on a Vespa, yeah? And she chugs along, and she gets round that track. She does get round it, but she isn't riding a Ducati. There is no heart to pump her around. So the lymphatic system does its job really well, but it can take its time, and when we have a deficit in the lymphatic system, as in, say, for us anyhow, for patients in this room, is probably going to be lymph node dissection, then it means that we need to pump that system along just a little bit more effectively. So lymphedema is where we have a breakdown in that system. So if you imagine your lymphatic system is a little bit like your plumbing system in your house, albeit one that maybe overflows the bath every now and again and blocks up the toilet and the sink's not running away properly. So we can have these little parts in the system that just don't work quite as well. Now, lymph nodes, as we know, are really important because they're little powerhouses of all the good stuff and they take away a lot of the bad stuff. So we want to try and keep a hold of those as much as possible. But as we all know in this room, sometimes that's not possible and sometimes they need to be whipped out. So if they have been whipped out, it means that it puts us at a much higher risk of having lymphedema. So, who gets it and why? Sometimes you can have lymphedema with regards to actual anatomy. So it could be that you have a tumour pressing on a particular area, maybe it's next to a duct or a set of nodes, and your lymphatic system just isn't able to drain in the most appropriate way. It might be an inoperable tumour, something that you can't get rid of, so therefore you end up with lymphedema. Most often or not in this room anyhow, I would imagine, it's going to be lymph node dissection, either partial or full. A sentinel lymph node biopsy carries really quite a small risk of lymphedema. Now, the latest stats, I hate stats and figures, but sometimes they kind of make a bit of sense. So the risk of having lymphedema after a sentinel lymph node biopsy is only about 5%. I mean, it's still not brilliant, it's 5%. It means you could possibly get it. When it comes to dissection, it can vary between 10 and 64%, and it kind of evens out at about 24%. That, to me, is quite a large amount of people, because that's pretty much 1 in 4 that might get lymphedema. So that's, I would say that's quite a lot. The other thing, as we know, what lymph nodes do is they filter out things, but they try their best to get rid of pathogens, they try their best to get rid of bacteria, as well as putting all those lovely T cells and immune cells back into the lymph to then do its job and go all the way back into the circulatory system in terms of through the blood. So if you imagine, it all comes all the way up towards the heart. So it's all flown up towards the heart, and then you're coming through vessels. Main vessel is here. One of the main vessels is right here behind your sternum, and then it comes into 2 ducts. You've got the duct on the right, which deals with this part of the body, yeah, and then you've got the duct on the left, which deals with everything else. I mean, how's that for inequality? Oh, poor left duct. But that is the way that it kind of goes. So we know who can get it kind of. We've got a good idea of why we might get it. So what can we actually do to prevent it? Have I got that there? Yes. So this is the proactive bit. I'm just going to have a little tiny sip. So first things first, it's ideal if we can try and keep a bit of a healthy weight, which might be difficult, especially if we've been on a load of steroids and all sorts of stuff. We're not as active as we were because of surgery or because we've been really poorly. But a healthy weight is super important. And it's mostly important because fat can quite literally block ducts. So adipose tissue, which is just a fancy word for fat really, it can block your ducts, so it can actually physically provide a barrier for your lymph to do all of its fleeing around on its vesper. So it's important that we try and keep a healthy weight as much as possible. I know how difficult that can be sometimes, especially when you've got that kind of cheesecake out there. The second one is movement. And of course, me being a physio, that's like my favourite thing. Motion is lotion. That was page 1 of physiotherapy school, by the way. So movement is it's the answer for many, many things. And what can happen is, so another analogy here, when we think about the bowel, when we eat and it goes all the way down and the food comes all the way down to the bowel, we have something called a peristaltic motion. And what that means is that muscles around the bowel will kind of squeeze the poop, for want of a better expression, all the way out and bosh, away it goes. We don't necessarily have that with the lymphatic system, but because of the way that it flows around the body, all of the muscles around it, so all of our normal skeletal muscles, when they are nice, fit, healthy, and they're moving, they're creating a nice, gentle kind of chivying along of that lymphatic system. So if people come to me, say for example, good example, this is probably the one that we see the most, breast cancer patient, mastectomy, full lymph node dissection. They come to us, maybe they've got some cordon or maybe they've got some tethering. So that's our primary goal. That's what we want to do. We want to help them with that. We want to try and get them out of pain. But then it's like, right, what are you doing to prevent lymphedema? Wow, I was given a sheet and put it in the drawer and not a lot really, to be honest. Right, okay, great. And this is where I get dead excited. I mean, I really need to get a life. But anyway, so this is where we can start to teach that patient, right, it's best if we prevent it or try to prevent it as much as possible. But there's also a caveat. And I think we'll know this as melanoma patients. Sometimes your risk factors can be tinsy. You can reduce them all the way down. So melanoma, might never have used a sunbed, might never have had any sort of sunburn, might not have it on either side of the family, might be fit and healthy and otherwise perfectly well, and then boom, guess what? You've got melanoma. It's a little bit like lymphedema. So you can do all of the good stuff, and I know sometimes you think, well, where's the incentive here, Kelly? But let's all try anyway. So you can do all of the good stuff, and you might still wake up with an arm that looks like a really bad balloon art. Sorry to be flippant, I'm not flippant, I'm just trying to inject a little bit of humour. So, what can we do in order to increase that kind of pretendy peristaltic motion that goes around the lymphatic system and helps it to squeeze it along? Movement is key. It's great if we can try and minimise the amount of time that we sit. So, if we're sat 10 minutes, God, what? Man, I'll be quick. So we don't want to sit a great, hang on, I've got 10 minutes left. Oh no. So we don't want to sit a great deal. We want to make sure that we're moving. I always call it the chicken ready on the clock. So every 45 minutes, the timer goes off, chicken's ready. No, it's not. I just need to have a little bit of a walk around, fling my arms around a little bit, get moving. Doesn't have to be mega. You don't have to go on marathon running or anything like that. You just have to move. Keep yourself pumping, keep yourself moving. The other thing that we want to think about is skincare. It's super important to look after our skin because when we have lack of lymph nodes, then we are at a greater risk of having infections and all sorts of things like that. So you want to make sure that your skin is moisturized, soft, supple, no cracks. You want to try and make sure that, you're making really good friends with your razor, not giving yourself little nicks, or just go au natural, might be even better again. Try to make sure that you don't get any insect bites, so make sure you get a really good insect repellent. I can definitely recommend Smidge. I'm not affiliated with Smidge, by the way, but it's a really good, what's it called? Yeah, thing. Anyway, stops you from getting bit. And then manual lymphatic drainage. Now, there's loads of different techniques out there, and this kind of comes into treatment as well. So we're just going to cover this now. Manual lymphatic drainage is something that personally, if it was me, if I had a load of lymph nodes whipped out, I'd be just doing this anyway all the time. Pretty much every day, I would just get really used to kind of looking after myself and doing it all in the way that I would want you to do it. Now, I cannot take place from any advice that you've been given by your own lymphedema team. Hopefully you've got one if you've got lymphedema. So please don't take this and go, oh, well, Kelly said I shouldn't be doing this. I'm totally not. I'm just giving you some suggestions. But what should be happening is when we're doing manual lymphatic drainage, it should be done in stages, and you should always be clearing your core first. You've got loads of lymph nodes around here, like, want to swear, but I'm not going to, like shizzle loads of lymph nodes here. And then we've got lymph nodes everywhere else, as we know, they're all over the place. So we kind of clear the abdomen first, and then we would go, say if we had lymphedema in the upper limbs, which we tend to get more limbs, legs, arms. Sometimes you get it in the neck, sometimes you get it in the face. You can get it anywhere, but it tends to be, certainly in melanoma patients, more those areas. And then you would be clearing it away. So you're always working towards the heart, but you're working away from the heart in terms of the elements that you're working on first. Susanna and I have already talked about this because clearly I've got loads to say and not enough time to say it. I'm going to make a video so that you'll be able to go on to Melanoma Focus and have a look at me saying all the things and showing you all the things and what to do. A huge part of this is tackling stress as well. Stress is a known cause of inflammation. If we've got inflammation in the body, we don't have any spare space in the body. So if we've got inflammation in the body, it's going to probably heighten our risk again to lymphedema. A way that we can tackle stress, and I know the doctor at the end is going to talk a little bit about that as well, but one of the ways that we can tackle stress, and Dr. Michael Mosley was the guy that kind of really pioneered this, is a reset button. It's our breath. Yeah, dead easy to do, dead simple. We're going to do it in a minute. And diaphragmatic breathing. Diaphragmatic breathing is bonkers important when it comes to prevention and treatment of lymphedema because, guess what? Biggest lymphatic vessel starts in the diaphragm. So if we're diaphragmatically breathing, which basically means breathing in through your belly, and not through your belly, because that would be bonkers, breathing in through your nose, into your belly, swelling the belly, and then letting it go, then we are actually giving that lymphatic system bit of a chug around. We're not turning her into, we're not giving her a Ducati, she's never going to get one of them, but she's going to feel like, oh, right, okay, yeah, I can get a bit of a move on. So, if everybody's up for this, we'll do, what time have we got now? 6 minutes, right. So, we'll do a little tiny bit of lymphatic breathing. No, not lymphatic breathing, diaphragmatic breathing, if that's all right. We're going to do 3 breaths to start with, and then we'll do another 3 breaths. So what I'd like us to do is just give yourself a bit of a shake, yeah? I've only been put on at this time, by the way, to stop you from falling asleep. You do know that, don't you? Okay. So we're going to breathe in through our nose, and we're going to shrug our shoulders. Going to let it out through the mouth. Come on, you can do better than that. Really sigh it out. Last time. Oh, listen to that. Great. So, first of all, what you've just done, you've kick-started your diaphragm. You've started to breathe into the belly instead of breathing in the upper apices, which we tend to do when we're older and we're stressed and we've got everything on our shoulders and we've got melanoma, let's be honest. So we've got quite a bit going on. So you've stimulated that diaphragm, which is great. Next of all, we're going to look at stimulating the lymph nodes in our tummy. I can't put this down because then you won't hear me. But if you put one hand on top of the other, right over the, I was going to give an anatomical term, belly button, that'll do. So one hand and then the other. Yep. Lovely. And we're going to do the same. We're going to breathe into the belly, allow those hands to swell. And then as you breathe out, I want you to push gently. Lovely. You do it, relax the shoulders. Great. And again, breathe in, swell the belly, breathe out. Push the tummy, and again, breathe in, and breathe out. Doesn't matter, just as long as you're breathing out. No fatalities on a Friday. So, again, we've started the whole lymphatic process. We've kind of got it chivied along. It started working. We've got those lymph nodes that we've probably got intact, hopefully, in our abdomen, and it's working. So when we do our lymphatic drainage techniques, then we would always start with diaphragmatic breathing. But it's a lovely technique to do at any time, particularly if you are stressed or just feeling a bit overloaded. Right, treatment. Compression wear. Ideally, you need to get this from your lymphedema nurse, lymphedema clinic, and then this is the kicker. Most people don't realise this at all. You should be replacing it every 6 months. It will lose its tensile strength, it'll become more elastic, and it won't do the same thing anymore. So you kind of need a couple of spares really in the background, and you need to be wearing those almost all the time. Sounds like, but you probably do. This is if you've got lymphedema. Avoid tight jewellery, waistbands, cuffs. So there's a difference between general compression over the whole entire limb to just little bits of compression in certain areas. That's actually going to make lymphedema worse, not better. Manual lymphatic drainage, and there it is again. So we have loads of different techniques. VODA were the people who Estrid and Emil back in the early 1900s, I think it was, 1800s. They were the real doctors that kind of got this in motion. And the problem with manual lymphatic drainage, there's not a huge amount of research because there's no big pharma paying for it. So the research is a little bit sketchy, but we have got more research coming out and we're changing our thinking. So once upon a time, I mean, I can hardly even believe we did this, but we used to tell people to do this. Tippy-tappy, yeah? So you used to tip around, and that was meant to stimulate the lymphatic system. It proper doesn't. Like, it really doesn't. What we need is as much surface contact with your hand and the piece of body that you're working on as humanly possible. So you need to kind of have your hand on, and you need to be sweeping up, not firmly, gentle but firm, rhythmic motions up towards the heart. And like I said before, if we need to get rid of some fluid in the upper limb, we're always starting abdomen, then we're going to come up here, then we're going to come make little Spocky things. Who was Spock, Trek, or Star Wars, one or the other? I mean, that would be probably a way to upset a lot of people, wouldn't it? Not knowing the difference between the two. So we're going to be doing this, then we're stimulating all the way around here, and then we're going to come round here, and then we're moving up towards. So there's a way in which you can do it. If you feel not particularly confident, please don't worry too much. Get help to start with. But if you still think, am I even doing this right? You can't really be doing it wrong. As long as you're always working towards the heart, but you must clear what you've got to start with. There's no point in thinking, I've got fat fingers, so I'm going to start on my fingers, because you're pushing it into somewhere that's already blocked. So it's about clearing the way first, doing all the stuff here first, and then either moving into the groin up towards the legs. And that's probably the most effective way that you're going to be able to get the most out of manual lymphatic drainage. Blood pressure as well. I mean, we'll get blood pressure taken a lot, I would imagine, in this room. Try and make sure it's on the unaffected side, if at all possible. And it needs to be done a lot. So your manual lymphatic drainage, every sweep needs to happen about 8 to 10 times, and you want to ideally make sure that you're doing it pretty much every day, if not twice a day. This is as a preventer. If it's as a treatment, I'd be doing it twice a day for sure, and it can make a huge amount of difference. The other thing about lymphedema is, because, you know, it's the gift that keeps on giving, the same as melanoma. If you don't have it to start with, don't think, it's me, I'm out of the woods, this is awesome, this, I don't have to do any preventative work. You probably do. Because what happens is it can sneak up on you maybe in 10, 12, 18-month time. So try and get those preventative techniques in now, healthy weight, make sure you're moving, and do a little bit of lymphatic drainage. I hope that is okay. Have I got any time left, or is that it? Aww. I wanted to leave you with a little bit of philosophy, but I'll save that for next time. Anyway, thanks, everybody. Thank you.
Thank you, Kelly.